In a natural menstrual cycle, the number of eggs that start getting ready to ovulate are very age dependent. But no matter what age the patient is, only one ovulates each month.
But in IVF, we take advantage of all those small eggs that have started to grow at the beginning of every menstrual cycle, and we push all of the eggs along so that multiple eggs can grow.
When a patient begins the IVF process, she begins with having an ultrasound and a blood test for estrogen and other hormones on the first or second day of her menstrual cycle. We then give her daily injections of reproductive hormones for 5 days and repeat that ultrasound and blood test.
At that point, it's still early enough in the cycle that we can adjust the hormone levels up or down to get just the right number of eggs that we'd like produced.
After another 5 to 7 days, we follow her more closely with repeated ultrasounds and blood tests
to get exactly the perfect size and hormone production from each egg so we know when the optimal time is to trigger ovulation. And we have the patient take a different hormone that matures the eggs.
The trigger shot allows the eggs to develop so that they can be fertilized, but it also causes the eggs to be released in 36 hours. So in those 36 hours, we have time to schedule her hospital appointment so that we can put her to sleep and then put a needle in the ovaries and get out those eggs before they're released.
So there's 2 ways to fertilize the eggs. If the sperm are good, healthy, vibrant sperm, we can just place a large number of sperm around the egg.
Sometimes in the cases where the sperm count is very low, we don't have enough sperm that would fertilize the egg in the petri dish. So we're able to pick up one sperm and inject it into the egg to allow for fertilization.
The day of retrieval, we'll know how many eggs we have, and we'll start that fertilization process. By the next day, we will know how many have fertilized successfully. There's certain things we can look for in that embryo.
Over the course of the next 3 to 5 days, we record the development of the embryo, and we're able to see it divide and make sure it's developing normally. This then allows us to pick the right embryo for transfer. Now we can transfer the embryo 3 to 5 days after the egg aspiration, or we can also freeze the embryo and transfer it at a later time.
High-quality embryos freeze quite well, and actually the pregnancy rate is very similar after they've been frozen and thawed as if they were fresh. We can do an embryo transfer either in a natural cycle, if somebody's ovulating regularly, has regular cycles, their hormones are working well. For others, where the cycles may be irregular or where some of the hormone levels may not be in balance, we prefer to use hormones to stimulate the uterus so that it's receptive to the embryos.
We start her usually on a pill, sometimes a patch, which delivers estrogen to her uterus. And then we follow her once again with repeated ultrasounds to make sure the lining of the uterus is thickening. When it is just the right thickness, we start a second hormone called progesterone. We then transfer the embryo after 6 days.
In most circumstances, we recommend transferring a single embryo at a time. To be pregnant with one baby is always the safest, healthiest way to have a pregnancy.
The patient remains on the hormones that we have given her until she has a pregnancy test. And luckily at Yale, most of our patients have a positive pregnancy test.
Our center is very comprehensive. We're not just an IVF shop. We take care of multiple other problems that can impact fertility. So we have specialists in endometriosis, specialists in fibroids, specialists in polycystic ovary syndrome, specialists in recurrent pregnancy loss and miscarriage. There's not a single cause of infertility, and it shouldn't be treated as a single disease. And we have the expertise in people who specialize in all the different aspects of fertility in infertility and can fit the pieces of the puzzle together to best solve why someone's not getting pregnant and customize their care to treat it optimally.